What really is the big deal about understanding non-viable tissue in wound care? Well, it's a question that deserves a thoughtful answer. The presence of non-viable tissue in a wound bed is a fundamental barrier to healing. It can inhibit the body's natural ability to heal, prolonging the recovery process and increasing the risk of infection. There are a few different types of non-viable tissue that we need to talk about. First off, we have necrotic tissue. This is dead tissue that results from an insufficient blood supply. It's often black, brown, or yellow in color, and may be firm or soft to the touch. Then there's slough, a type of non-viable tissue that's yellow or white and may be stringy in appearance. Slough is often a result of inflammation or injury to the skin. Last but not least, we have eschar, a hard, black, leathery tissue formed as a result of burns or pressure ulcers. Now, you might be wondering what causes these types of non-viable tissue. Well, they can result from a variety of factors. Necrotic tissue, for example, can be caused by conditions that restrict blood flow, such as peripheral artery disease or diabetes. Slough, on the other hand, can be caused by inflammation, infection, or injury to the skin. Eschar, meanwhile, is typically caused by burns or pressure ulcers. So, how can we deal with non-viable tissue? The most common approach is debridement, a process that involves removing the non-viable tissue to promote healing. There are several methods of debridement, including surgical, mechanical, enzymatic, and autolytic. The choice of method will depend on the patient's overall health, the type of wound, and the amount and type of non-viable tissue present. To summarize, understanding non-viable tissue in wound care is crucial because it can inhibit the body's natural ability to heal, prolong the recovery process, and increase the risk of infection. There are different types of non-viable tissue, including necrotic tissue, slough, and eschar, and they can be caused by a variety of factors, including restricted blood flow, inflammation, infection, injury, burns, and pressure ulcers. The most common approach to dealing with non-viable tissue is debridement. Thank you for tuning in, and remember, understanding these concepts can make a big difference in a patient's recovery process and overall well-being. Stay informed, stay sharp, and keep learning.